Welcome to Impact by DIFFA Dallas, the official podcast of the Dallas chapter of the Design Industries Foundation Fighting AIDS. We'll share valuable info about the fight against HIV and AIDS, what our organization is doing to assist those in our community, and most importantly, how you can help us make a real impact.
Hello, everyone. Thanks for tuning into this episode of Impact. I'm your host, Shane Allen. Today is HIV/AIDS Awareness Day. And to talk about that, I thought, what better person to bring in than the guy in charge of Latino HIV Awareness Day? Seriously. Luis Mares is with the Latino Commission on AIDS, and he is, in fact, in charge of Latino HIV Awareness Day. Luis, how are you?
Hi, good morning. Thank you for inviting us to your program for the podcast. Yes, I'm Luis Mares, and I'm working at the Latino Commission on AIDS. We are based in New York City, but it's an organization, a nonprofit organization that have influence all over the country through our network with different organizations in every state, possibly. Yes, and I am in charge of National AIDS Awareness Day.
You know, low-key, just not a big deal, right? How did you get involved in the Latino Commission on AIDS?
Well, I moved to New York City in 1997, and I started working for a different organization back then, 98, the YMCA of here in New York. And I was initially in charge of coordinating the health services for homeless people living with HIV. I worked with them for 14 years. I ended up being the director of the program, the housing program for homeless individuals living with HIV. And then I went back to school to get a master's in social work in NYU, and that's when the Latino Commission on AIDS contacted me and offered me an interview for this position. That was in 2017. And since then, I'm with the Latino Commission on AIDS.
That's great. So let's talk about why it's important to have a Latino HIV/AIDS Awareness Day. Okay.
NLAAD, National Latino AIDS Awareness Day, was created back in 2003. This is the year number 18 for this campaign, national campaign that happens as today, October 15 every year, which is the last day of the National Heritage, Hispanic Heritage Month, and that's why it happens on 15. What is important? It is important because the Latino community is very disproportionately impacted by the HIV epidemic. We have a lot of numbers to support this, but just to start with, it's like we Latinos represent only the 18% of the population of the country, but we represent from 26 to 28% of all new diagnoses of HIV in the country.
Why do you think that is?
Oh, there are so many reasons. There is a lack of information for the Latino community. There is language barrier in many cases. We found that of all Latinos that are diagnosed with HIV per year, more than half of them, 53% are new immigrants. They come from different countries, so they probably speak only Spanish. So we need to develop message carrying the information of all the prevention techniques, prevention methods, testing in Spanish for them. Besides social determinants of health. As with every epidemic, including COVID in the present, poor communities that don't have access to social services, to medical services, are more impacted by these epidemics.
What kind of impact have you seen since Latino HIV/AIDS Awareness Day has started? What kind of impact have you seen in kind of helping that conversation and increasing that knowledge among people?
It's very difficult to measure the impact that we can have in this campaign, but we measure our reach to people every year. For example, last year we were able to coordinate or support more than 110 events through the country in more than 25 states, and we were able to reach about 40,000 people in Latinos, mostly in all these events. We were able to test more than 2,000 people and connect people to PrEP and refer them. 7 people came out positive in the test, and they were connected immediately to medical services. We also distribute condom and educational pamphlet information on HIV.
Big plans today?
Yes, we as every year. Well, this year is going to be something different because of the COVID pandemic. Everything has changed. Every year we have a press conference that happened on the City Hall steps of New York City. This year is not going to happen. So we are just doing social media awareness. We are going to be very busy today with all these communications that we're handling.
Do you find that all of the information that's out there, and rightfully so, about COVID-19, is that making it more difficult to get important information out about HIV and AIDS awareness?
Well, we're having this situation with COVID-19. Like every year, as I mentioned, we have over 100 events, and most of them are in-person events. So every organization that participates in the campaign in different cities, states, counties, they own the campaign, and they decide what type of event they're going to have. It can be as simple as just testing day, so people come to their offices or their events and get tested, or they can have like bigger events like a social, cultural event with dancing or theater and things like that. But this year can't happen. So it's definitely impacting our reach to people and how we're going to deliver them the information that they need.
How are you repositioning events today?
Basically, we have also webinars that happen every year, but webinars are directed towards people that work in the organizations more than the people in general. So we provide this information to the organizations, and they pass the information to the clients or the people they serve. So mostly this year has been through social media interviews, like this one, and printed materials.
So, HIV/AIDS Awareness Day, it's just one day of the year. But what can someone do, and what does the Latino Commission on AIDS do every day to try to promote or to try to get this information out, I should say?
Yes. We have, as you mentioned, this is only one day in a year. We have it every year, but the campaign starts happening, or the coordinations and everything start in August, and it doesn't end on October 15th, ends in December, and we collect all the information to create the reports of it. But the Latino Commission has also had other components, and we work a lot in advocacy for the health of the Latino community, policy. We have big campaigns that happen in March in DC and in Albany, in New York. We bring information to the people that create the laws. So we advocate for laws and budgets that promote programs, not just in New York, but in the entire country to help the Latino community in the area of HIV and AIDS.
So you mentioned earlier that part of the events that you have are testing events and things like that, and that you actually found that folks actually tested positive for the first time because they went to a Latino HIV/AIDS awareness event. Do you find in this world of COVID-19 that testing is down just because people are not going to their doctors or not going out as much?
Yes, it's been reported actually. Yeah, the testing number has gone down because of COVID-19. But depending on where you are, mostly the health departments of the city or the states, in coordination with organizations like ours, for example, are promoting home tests, HIV home tests. It is more difficult than when people just go to get tested. But as the cities are reopening, more programs are starting to reopen as well, and people is being able to go back to the usual routine HIV testing.
A couple of weeks ago, I interviewed Dr. Paul Volberding, who is one of the world's leading experts in HIV and AIDS research and treatment. And I'm kicking myself now because I should have asked him this question, but I'm going to ask you because it just came up into my mind. Do you think that COVID-19, and with more people, not everyone, unfortunately, but with more people staying at home, socially distanced, playing it safe, do you think there will be some sort of halo effect of a lower transmission rate, perhaps?
Well, we will know that when the numbers are tabulated by the CDC next year. We don't know. It might have an effect because people is isolating and are not having, but that HIV is transmitted mostly by sex. and it's mostly on MSM, mostly in young people. How they are limiting their interactions and their sexual intercourse with different people, or if it's in a lower amount, we don't know. There's no way to measure that. We will know that next year when the numbers come up.
Well, what can someone do today, right now, to help get the word out about Latino HIV/AIDS Awareness Day?
Well, promote it, a tweet, go to our Twitter handle, NLAAD, or our Facebook page, or on our website, and you can share that information with different organizations about not just HIV testing, but it's important to know that people living with HIV, people that are diagnosed with HIV, they need to be in treatment and stay on treatment so they can reach what we call viral suppression. What we call undetectable. And this is important because their life gets better, they can live a normal life. And even more important now that we know there's a campaign called U equals U, which is undetectable equals untransmittable. People living with HIV whose viral load is undetectable cannot definitely pass the virus to other people through sex. There is a lot of information that needs to be transmitted. Also, there's a pill called PrEP, that prevents people from getting HIV from other people.
Yeah, and it's important, we have all of these tools in our toolbox right now. We have the ability for people to be living with HIV to be undetectable. We have PrEP, which has a 99% success rate in preventing the transmission of HIV. The reports of people with HIV who are undetectable and people who are on PrEP transmitting the disease from one person to the other are nil, if any. So it's so important. It's such an easy thing to do right now to be part of the solution in helping us ultimately see, hopefully in my lifetime, in our lifetimes, an AIDS-free generation. Yeah,
so we are working on that actually, not just us as an organization, but the government of the state of New York started to what you call end the epidemic plan. We started like a few years ago, and we are supposed to end the epidemic this year, 2020. But the federal government also had a plan to end the epidemic in the country by 2030, based on all these tools that you just mentioned, testing, PrEP, condoms, U treatment, all of it. Yep.
Yeah. And certainly the work that the Latino Commission on AIDS does is helping us toward that goal. Luis Mares, thank you so much for taking some time to talk to us today. You can learn more about Latino HIV/AIDS Awareness Day on the Latino Commission on AIDS website or on their social media handles. Share out the information and help be part of getting this information out to everybody. It's so important. Thanks for watching.
No, thank you. Thank you for inviting us.